In Alder's casualty department, Mike Callahan is trying to see his first patient.
I should just be able to press number 1 now, shouldn't I?
To get into admissions.
If the new computer system will let him.
It just goes back to... Well, I can get so far down here. It goes back to Nat.
OK.
Natalie Sweeney! Swallowed a set of keys. Have you really?
Yeah.
Big or small keys?
No, they were about that big.
What are they off?
Locker. One of the mates' locker keys. Well, was
Right.
them on a keyring.
And how have you swallowed a bunch of keys?
She said something to me, so I took them off her. I was like that, and I put them in my mouth. I went, I haven't got them, and then one of the mates came up behind me and whacked me on the back.
Judy, can you give some advice?
Absolutely, the base part for that, and it'll be previous patients.
I have no problems with it. Reprint instruct. Oh, 36.
Under normal circumstances, Nan, anything that's swallowed normally just takes the place of food and goes right through and comes out the other end.
Yeah.
Right, but this is quite unusual. So she may well be sent for an X-ray just to find out how big the keys are and whether they're going through the normal track that food would go through. So she'll probably be told, only return if you get into any trouble. Or you can't get into your locker. I'm putting this in like I should do.
Ah, because you're using the numeric keyboard and we haven't got num-lock on. Is that OK?
Cheers, thank you very much.
OK.
He's on to the hospital.
9-year-old Jason Woodruff has come into casualty with severe stomach pains.
Come on then, should we take you through here? While your mum's Amy?
Do you want to lie down on this bed here?
He's well known in the hospital, having had several operations to deal with the effects of spina bifida, a defect in the spinal cord.
I'm Liz Sweeney, I'm one of the casualty doctors. Hi, Jason. What's been happening?
About 20:05 this morning, really bad pains.
Right, so he was completely well until this morning, was he?
Yeah.
Right, OK. He looks very pale. Is he usually...
No.
No, he's not usually. Has he had anything for the pain yet? No. OK. Let's have a little listen to you. Where's it sore, Jason? Can you show me on your tummy? All around the bottom, and it doesn't go anywhere else? It's just there, is it? All right, sweetheart, very good. What I'll do is I'll have a little word with the surgeons and ask them to come and have a little look at him, because his tummy's quite tense and he doesn't like me pressing on it at all, so there may well be something going on with his tummy. All right. In the meantime, what we need to do is get a drip in him, take a few blood samples off for some testing, all right? Don't worry, be all right. He will. All right. I'll just ring the surgeons. Oh, hi, sorry to bother you. It's Liz Sweeney, one of the casualty SHOs. I've got a little lad of 9 called Jason Woodruff. He's very tender across the bottom of his abdomen. He's quite pale and quite unwell. Your reg has just asked me to get you to have a little look at it, if you wouldn't mind.
On the other side of the hospital, 21-month-old Darryl Lowe has come into the radiology department for tests on a large growth that started soon after birth.
Darryl wasn't born with a birthmark, but about a month after his birth, he started to get a birthmark. 12 months later, it's just started to get bigger and bigger and bigger. When it first started, Darryl's birthmark was purple. Now, the laser treatment was to reduce the size of the birthmark and also get rid of the colouring. It's a lot paler than what it was, but the size is still too much.
People staring at him when he's in the streets, nasty remarks when we've been down in town. It's just not fair on him.
If it's gone before he goes to school, then he isn't going to get the nickname and he isn't going to get the grief. Myself, I had big eyes, so they used to call me Popeye and things like that. And it is hurtful. At the end of the day, it's hurtful. I mean, you can laugh it off while you're at school, but you come home and you always go to your parent and go, oh, no, they've been going at me again, and this, that and the other. And really, I don't want him going through any of that, if I can help it. I'm trying to protect him.
You know that there are several kinds of these vascular malformations, this sort of birthmark type situation. And looking at this one, there are possibilities for treatment. But before we get anywhere near that, we have to look at it in more detail and try and map the full extent of the lesion inside. You can see it on the outside, but it's much harder to see what's going on inside. What all that shows.
Professor Helen Carty is the hospital's senior radiologist.
There is a possibility that the way to treat this is to inject a substance which is a mixture of glue and alcohol.
Right.
And the alcohol tends to block the vessels.
Right.
And the glue deliberately is designed to set up a fibrous reaction inside the lesion to give it a chance. There you are, sweetheart. There we are. To give it a chance to try and heal up.
Yeah.
So by stopping the blood supply to it and by blocking the centre bit of it, the hope is that this will actually cure it without him having to have surgery to excise it. Now, I don't know whether this is suitable. Obviously, we take this one step at a time because we don't rush into anything like this. We want to be sure that it's the right thing to do. Right, well, here's hoping.
Yes.
Okay.
Fingers crossed.
Right. See you later, Darryl.
You say bye-bye.
Bye-bye.
Say bye-bye.
Bye-bye.
Consultant surgeon Rick Turnock has operated on Jason in the past in connection with his spina bifida.
Hello, Jace. Hello, mate. What's been happening?
He's got really bad pains.
When did this start?
It started this morning.
Has he been sick at all?
He's vomited.
What's he brought up? Right, okay. All right, mate.
Water for injections.
Yeah, me and Jace are all mates. Yeah. Hands a bit cold, mate, okay? Where's it most sore? Do you know which corner it's most sore? Down in this corner here. Has he had some morphine yet, or you're just about it now? Okay, I'm just going to go and have a quick word with your mum, all right?
You probably want to see a clean shop.
It's going to be 2 minutes. There's something going on in his tummy, there's no doubt. With all the operations and things he's had, the most likely thing is that there's a loop of bowel caught up with adhesions, scars inside the tummy. We'll get an X-ray. Obviously, it needs to come in, but I suspect that we're going to have to have a look inside. I'm afraid. Okay. So we'll get a drip put up and get him some fluid, give him some antibiotics, give him some morphine, and we'll get him up to the ward with an X-ray on the way. Okay, and I'll see him up there in about an hour or so. Okay, I'm sorry. An X-ray, some antibiotics, morphine and fluids.
Start the antibiotics.
Start the antibiotics now. The brown vomiting means that his bowel's obstructed. He's quite tender. He's obviously poorly and in a lot of pain. And this isn't, I know him well, and this is not the normal Jason Woodruff. You know, he's normally a bright little fella. So basically, we're going to get some X-rays, get him up to the ward, try and get him into a bit better shape, get him rehydrated, some antibiotics. And then I suspect later on today we're going to have a look inside his tummy and sort out whatever's going on.
Alder surgeon Paul Losty is on his way to Liverpool's Women's Hospital to check up on one of his youngest patients. Chloe and her twin sister Toni were born 13 weeks prematurely.
Dear God, bless this little girl. Bless her as she goes for this operation.
Toni had the additional complication of a hole in the diaphragm that needed urgent surgery when she was only 6 days old.
This baby is 13 weeks premature. God didn't expect it to be on this earth for at least another 13 weeks.
Bless the hands of those who will perform this operation.
This condition has a 50 to 60% mortality.
Paul Losty had to reposition Toni's bowels, which were pressing dangerously on the heart and lungs.
This is quite a big defect. We found what we expected to find. The operation couldn't have gone better. But it's early days yet. Well, unfortunately, the other little twin died. She was transferred from the other referring hospital when she became increasingly unwell. And the neonatologists at the Women's Hospital feel that this is probably related to sepsis or infection, which is very sad for the parents, and it's been a very difficult time for them. And the funeral was last week.
Paul Losty is hoping to find that Toni isn't developing a similar condition to Chloe's.
So how's she been doing over the last year?
Well, she's not been too well actually at the moment. She's, I think she's got an infection at the moment, so we've had to stop the feeds.
Right.
She hasn't got too far with them really, and she's had her bowels open for a day or two. So.
Right. How's the mother doing then?
Mum's not really coping very well, probably because of Toni's sister Chloe, and such an unexpected quick death, and she really is comparing Toni now with Chloe, anything Toni gets, because Chloe had some abdominal problems. She's thinking that Tony's going similar.
Well, that's understandable. Could I let those cut size down completely so I can have a look now? Thanks very much. And if I just take your little, if I may, just to get her flat. Well, she's a bit up and down, isn't she? It's one day at a time, isn't it? Again, there we go. Things are sort of 60-40 in the baby's favour at the moment. Infection is always a worry because these babies can change very suddenly their condition, and increasingly the organisms that cause infection are changing all the time and becoming more virulent and aggressive. I'm a little disappointed with the baby's situation today, but we must always give the family encouragement, but at the same time we must always let them know how we feel about the baby, and it would be wrong to give overwhelming optimism when we ourselves are being cautious. But they must see that we're not throwing in the towel as well, that we're doing everything we possibly can.
Back at Alder, Jason has been moved onto the ward to be prepared for his emergency operation.
It wasn't until he was born. He had a large lump on the base of his spine. And they took him away and examined him and brought him back and said that they thought it was spina bifida. People say spina bifida, they usually think of children in wheelchairs, but there's more than one type of spina bifida to different degrees. And luckily his is, it doesn't affect his legs or anything, just his bladder and his bowel.
Jason is brought into theatre just 3 hours after he arrived in Casualty. Rick Turnock hopes that he'll discover what's causing Jason's pain.
Poor old Jason. When we saw him in Casualty, he was just an ill boy with a distended abdomen and a lot of tenderness, particularly down in this lower left-hand side, and an X-ray subsequently which really shows no real sign of obstruction, but I may have made the wrong decision to do an operation, but with the findings, it would have been impossible to have left him. So it's a voyage of discovering that we're not sure what we're going to find. He's been through a lot, this little lad, and he's a toughie. He's a boy who's got problems with his bowels in regard to his continence. And we gave him a little hole on the side called an ACE procedure. And he pops a tube in every couple of days and washes his bowel out while he sits on the toilet. Scissors, please. And he's been fantastic with it. He's been a great success. And Mr. Rickwood, our urologist, has done an operation on his bladder to increase the size of his bladder by putting the bowel in on top of the bladder. And that's also been a great success. But what's caused this sudden sort of problem, I have no idea.
Specimen prop, please.
Something's happened. Catheter's in.
Yeah. And he had passed some urine this morning. It's not as if he was in retention.
The bowel Mr. Rickwood plugged into the top of his bladder is hugely distended. You go and see if Mr. Rickwood's available. Try his office. Say it is urgent.
In radiology, Darryl Lowe is going to be anaesthetised to make it easier for the tests on his growth to be carried out.
So there we go. Whoa. Not impressed, is he? Can we pop his head on the pillow? There we go. Okay, trying to give him a kiss? There we go. Back in about an hour or so.
Yeah.
Okay
then. Yeah.
Self-inflating bag.
Professor Carty will apply several tests to establish if it's safe to use the glue mixture. First is the magnetic resonance imaging.
What this will tell me now is it will show me the relationship of this lump, which is the lump that you can see on the outside when you look at Darryl, to show that it is confined to outside structures. And it allows me to map, for want of a better word, to make a map of the lump. It's okay. It's just
A simple dye injected into the growth will reveal where the veins flow and whether they're connected to key areas in the body.
This isn't good.
Only when these results have been reviewed will Helen Carty be able to tell Darryl's parents if it's safe to use the glue mixture.
Deep.
England have got to give it away if it's not a draw.
In theatre, Rick Turnock is waiting for senior surgeon Toni Rickwood, who'd carried out the earlier operation to increase the size of Jason's bladder.
This boy, you know, Jason, we've had the catheter in for 2 hours and it's been draining small amounts of, you know, reasonable amounts. He's got his augments up to his diaphragm. Huge, it's like the size of a rugby ball.
Is that right?
Yeah. The valve's fine, there's no problem with the valve at all. It's all just sort of squashed up.
No leak?
No leak, no urine, completely clear, no leak. Do you want me to put a suprapubic in and come out?
I'll have a look if I may.
Yeah, sure. The main man's coming to have a look. We all call Mr. Rickwood the boss because he's the boss.
A week ago, Martin Stowell had a bag implanted underneath his scalp. The aim is to inject saline into the bag to stretch the skin so it'll cover areas of exposed skull.
I hate going and getting this saline put in because my head's grown. My head's big on one side and it's not on the other.
He's fine getting the saline, but when we dressed his head and time to come out the room, he won't come out the room.
Just didn't like walking around with my head out of shape.
Martin Stowell.
Right, hat off, I think, and...
This is the latest stage of treatment to repair damage caused when Martin was burnt by an overhead electricity cable on a railway line.
Yeah, it's getting quite big now, isn't it? Good. Right, do you want to lie down in your usual position? Right. OK. How's that one? It's all right, good. The larger it grows, the more we seem to be able to put in without it being uncomfortable. How does it feel now?
Stretching.
Yeah. I know you'll tell me when you've had enough. That's about 30, you see. OK? Yeah, it's fairly tense now. There we are. Looking fine. I mean, already, you know, it's big enough to be able to spread over now. But we booked you in for, was it next week? Have you had a letter? We haven't had a letter. I think it was next week that we penciled you in for. But we ought to be able to, besides covering over these two areas, we ought to be able to take it over here as well. And also, you know, to take out quite a bit of the graft. All right? How are you coping with that? But you won't have to get too big a hat then, I think.
Can't get any bigger.
OK, fine.
Do you want your mum to do the dressing, Martin? You clean it and then I dress it. OK.
In theatre, it's hoped that Toni Rickwood will be able to find out what's causing Jason's condition.
Well, let us apply logic to it. If urine is coming out...
Which it is.
Which it
There's
is.
300 mils in the bag now.
And if urine is...
there's urine in there because I've tapped it,
ergo there's a way through.
There's certainly a way through in certainly at least one direction. Whether there's a way through...
It's just a question of
whether you drain it and then investigate it.
Get down a bit and just expose the bladder itself.
Well, I'll have a go, yeah. Easier said than done. Give us the buzzer. We reckon he looks like Robocop in these. Yeah.
I think you can go down...
No, that side, yeah, that's how I can see now. Yeah. There's that.
So what we need to do, I think, is open up like that.
Right, OK. Do some stay sutures?
Gear some stay sutures.
Some silk stay sutures.
3 O's,
yeah.
Gear messed
What we're doing now is we've exposed the bladder at the bottom of the abdomen. And we're going to open up the junction between the bladder and where the bowel is clamped on the top where it's blown up. in a controlled fashion, but and you'll see we've got the sucker ready because there's going to be about a gallon of urine going to hit the pot in a moment.
Right, let's have the blue one. Is it? Yeah. Why doesn't it drain into his bladder? That should make him feel better.
The sucker is filled. We've all got half a litre, 700 mils. 900 mils, about a litre of infected urine inside that thing. Yeah.
Martin will need to make further visits to have more saline injected into the bag before it's removed and the scalp is stretched over the skull.
I've looked in the mirror. That better?
No, that's too high up.
Right. I booked you for the week after next. Is that all right? It's in the book. Why not?
Yeah, that's too big.
Yeah, the bigger the better, because the
I
more...
I don't like walking around.
Well, it's not much longer. It is only a week and a half before we do this. And that'll give us an opportunity to get it as big as we can, so that...
I'm not getting it any bigger.
Well, the bigger we get it, then the more graft we can remove. It's up to you. We can stop there if you like, but you're nearly there now with this one, and I'd like to do some more injections if we can to get it up there, and it'll be helpful if we can have another two, and then it'll give us a great start then. Okay.
Ciao.
Bye-bye. Yes, like you said that once before. He said, I'm not going to have any more injections. And the next time he came, he was absolutely fine. So I suspect it'll be the same on Monday.
The theatre team is still baffled by what's causing the blockage in Jason's bladder.
There's no problem at all, in fact, that I can feel.
What we're wondering is, we can't actually, having opened the bladder up and drained the urine away from everything, there doesn't appear to be a discernible problem. What we're wondering is whether it's filled and kinked over and obstructed itself.
One thing we could do is do a longitudinal incision so transversely, and that'll open it up. So I think of everything. Let's have the blue one.
It's called thinking on your feet, boss.
Thinking on your feet.
Yeah. What sutures would you like?
Duochromic.
Duochromic cat gut plate around bodied.
Not fancy.
You wouldn't like to try one of the more modern sutures?
No,
I thought not.
Where's everything disappeared to? Where's my poor section of people?
He was behaving like a boy with a distended loop of bowel, which is what we were worried about in casualty, that he'd got a loop of bowel that had twisted and become distended. And in fact, he had a distended loop of bowel. It wasn't, as the boss says, not the loop we thought. And in fact, what happens is that when you plug a piece of bowel in on top of the bladder, the body, in its sensation, still feels as though it's a piece of bowel, not... So he wouldn't have felt as though he had a full bladder, like, as you and I would experience if we've had a couple of beers and sitting crossing our legs at Anfield or wherever. It would be... He would feel as though that there was a loop of bowel, and that's why he was looking, fairly dreadful in casualty.
With a bit of luck, it'll be MOT.
What's MOT?
Moment of truth.
Right.
We'll need a
syringe and a litre of saline. Yeah, fine.
Check the leaks.
We'll have a... Do you want to put your sump drain in and then I'll...
There's a sigmoid.
Yeah.
Nothing wrong with that.
Yeah. It's sort of good news and bad news. Well, not really bad news. What we found, I had to open them right the way up and down, I'm afraid. What we found was that where the augment had been sewn into the top of his bladder, the bladder was draining fine into the catheter, but the bowel that Mr. Rickwood had sewn in the top of the bladder was like the size of a rugby ball full of urine.
Why?
Oh, we don't know. We don't know. What we felt was we've done, what we needed to do was to get him right, to get him better. So we've sorted out the immediate problem, and I think we just let things settle down, give him antibiotics, let everything calm down, get him back eating and drinking, get him back working the ACE, and then I think Toni will probably want to do some more investigations.
So is it finished now?
Oh yes, yeah. I mean, he's sewn up. Dr. Willingham's just waking him up, getting everything sorted out. And as soon as he's sort of awake enough to come back up in the lift. All right, I'll see you after the weekend. All right. Cheers now. Bye.
Jason's condition is now stable, but the team will keep him in for further tests until they're sure the blockage will not reoccur.
Come along in then and I'll show you the pictures as promised.
Darryl's parents are hoping that the test results will confirm that a simple procedure will deal with the growth.
Okay, these are the magnetic resonance pictures. These are the veins that are draining this lump in his face.
Yeah.
While they were making these pictures, because this takes a little while to make, I popped a needle directly into the lump. I don't think you can see the pinpricks where they were, and you may just see one up there, right? But if you can see here, there are little squiggly vessels. Do you see this sort of little squiggly snake-like marks coming up along there?
Yes.
Here. And the problem is these are going upwards towards the back of his eye. So they're going in deep rather than, as I had hoped, draining downwards into his neck. And clearly, as they're going upwards in the back area, I don't think this makes this suitable for being able to inject the glue that I had hoped to be able to inject, because that's going up towards his brain, and for obvious reasons I don't want to do anything in that area. So I would not be prepared at this stage to recommend to you that we inject the glue, but what I will do is take some advice from other people. But I think it's only fair to say that I think the advice will be the same as what I'm actually...
It's safety first, really.
Safety first, yes, this is what it is. It's not what I expected, but that's why we did the test. So I'm sorry. I had hoped, because I'd hoped it was the ideal situation.
Right.
Is that for me, Darryl? Thank you.
It does hit you, and it hits you hard. But you get up and you stand up, and we'll have another go, see what else there is. That's all we can do.
I was disappointed, yeah. Just one of those things. I wanted it to work, innit?
There's still a chance. There's still a chance.
I don't know. I'm hoping eventually that'll be done properly, and I don't know, it just doesn't seem fair.
There's a lot of people worse off than what we are, and at the end of the day, it's only his looks. It's not as if he's disabled in any way or anything like that, so we've got to be happy about that side of it. That's all you can do, really, isn't it?
Yeah.
He's still our little man, aren't you?
Darryl's parents will now have to look at other treatments which could involve facial surgery.